Diagnostic procedures for assessing endocrine function. Welcome back. Now that we've covered the basics of the endocrine system and some common disorders, it's time to delve into the methods used to diagnose these conditions. Proper diagnosis is crucial for effective treatment and management. In this session, we'll explore various diagnostic procedures and tests used to assess endocrine function. 1. Blood tests, the foundation of endocrine diagnostics. Blood tests are the most common and essential tool for assessing hormone levels in the body. They help in diagnosing many endocrine disorders by measuring the concentration of specific hormones in the blood. Here are some key blood tests. Thyroid function tests, TFTs. These tests measure levels of thyroid-stimulating hormone, TSH, free thyroxine, FT4, and free triiodothyronine, FT3. Abnormal levels can indicate hypothyroidism or hyperthyroidism. TSH, elevated in hypothyroidism and reduced in hyperthyroidism. FT4 and FT3, usually low in hypothyroidism and high in hyperthyroidism. Blood glucose tests, essential for diagnosing diabetes mellitus. These include fasting blood glucose, measures blood sugar levels after an overnight fast. Levels above normal indicate potential diabetes. Oral glucose tolerance test, OGTT, involves fasting, consuming a glucose-rich drink, and measuring blood sugar levels at intervals. It helps in diagnosing gestational diabetes and type 2 diabetes. Hemoglobin A1C, HbA1c, provides an average blood glucose level over the past 2 to 3 months. It is a key indicator of long-term glucose control. Cortisol levels, measured to diagnose conditions like Cushing's syndrome, high cortisol, and Addison's disease, low cortisol. Blood cortisol levels are often tested at specific times of the day due to their natural diurnal variation. Calcium and parathyroid hormone, PTH, levels, used to assess parathyroid gland function. High calcium and PTH levels may indicate hyperparathyroidism, while low levels suggest hypoparathyroidism. Sex hormone levels, for diagnosing reproductive hormone disorders. Testosterone in men for hypogonadism. Estrogen and progesterone in women for menstrual irregularities or infertility. Follicle-stimulating hormone, FSH, and luteinizing hormone, LH, are also tested to evaluate pituitary gland function. 2. Imaging studies, visualizing the endocrine glands. Imaging studies are used to visualize the endocrine glands, especially when there's a need to assess the size, structure, or presence of tumors. Ultrasound, a non-invasive imaging technique that uses sound waves to create images of internal organs. It's commonly used to assess the thyroid gland for nodules or enlargement and to evaluate the ovaries and testes. Computed tomography, CT, scan, provides detailed cross-sectional images of the body. It's particularly useful for examining the adrenal glands for tumors or abnormalities. Magnetic resonance imaging, MRI, offers high-resolution images, especially useful for detecting pituitary and adrenal tumors. MRI is preferred when detailed images of soft tissues are required. Nuclear medicine scans. These scans involve the use of small amounts of radioactive material to visualize the function of endocrine organs. Thyroid scintigraphy, also known as a thyroid scan, it assesses the function and structure of the thyroid gland by measuring the uptake of radioactive iodine. Positron emission tomography, PET, scan, often combined with CT, PET-CT. This scan is used to detect cancerous tumors in the endocrine glands and assess their metabolic activity. 3. Stimulation and suppression tests, evaluating hormonal responses. Stimulation and suppression tests are specialized procedures used to evaluate how well endocrine glands respond to signals that should either stimulate or suppress their activity. These tests are crucial for diagnosing certain conditions that might not be detected by standard blood tests alone. ACTH stimulation, Test. This test assesses adrenal gland function. Synthetic ACTH, adrenocorticotropic hormone, is administered, and cortisol levels are measured before and after the injection. It helps diagnose conditions like adrenal insufficiency, e.g., Addison's disease. Dexamethasone suppression test, used to diagnose Cushing's syndrome. Dexamethasone, a synthetic steroid, is given to suppress cortisol production. In Cushing's syndrome, cortisol levels remain high despite the suppression attempt. Glucose tolerance test with growth hormone measurement, used to diagnose acromegaly, a condition caused by excess growth hormone. After administering glucose, normal individuals show a reduction in growth hormone levels, but in acromegaly, levels remain elevated. Water deprivation test, used to diagnose diabetes insipidus, a condition characterized by excessive urination and thirst. The test evaluates the body's ability to concentrate urine during dehydration. In diabetes insipidus, the urine remains dilute despite water deprivation. 4. Biopsy, examining tissue samples. In some cases, a biopsy may be necessary to evaluate suspicious masses or nodules within endocrine glands. A small tissue sample is taken and examined under a microscope for signs of malignancy or other abnormalities. Fine needle aspiration, FNA. Biopsy, commonly used for thyroid nodules. A thin needle is inserted into the nodule to extract cells for analysis. Core needle biopsy involves a larger needle to remove a small core of tissue, often used for larger or more solid masses in glands like the thyroid, adrenal glands, or pancreas. 5. Genetic testing, identifying hereditary endocrine disorders. Some endocrine disorders are genetic, meaning they are passed down through families. Genetic testing can identify mutations in genes that may predispose individuals to certain conditions. Multiple endocrine neoplasia, MEN syndromes. These are hereditary conditions that lead to the development of tumors in multiple endocrine glands. Genetic testing can identify mutations in the RET gene associated with MEN type 2, for instance. Congenital adrenal hyperplasia, CAH. A group of genetic disorders affecting adrenal gland function. Genetic testing can identify mutations in the genes responsible for this condition. Treatment approaches for endocrine disorders. Having discussed how endocrine disorders are diagnosed, let's now focus on the treatment approaches. Treatment varies depending on the specific disorder, the severity of the condition, and the overall health of the patient. Common treatment strategies include 1. Hormone replacement. Therapy. Hormone replacement therapy involves replacing deficient hormones in the body, which is a common treatment for many endocrine disorders. Thyroid hormone replacement. For hypothyroidism, synthetic thyroxine, levothyroxine, is administered to normalize thyroid hormone levels. Insulin therapy. For diabetes mellitus, insulin injections or an insulin pump may be used to manage blood glucose levels. Corticosteroid replacement. In Addison's disease, synthetic corticosteroids like hydrocortisone are used to replace deficient cortisol. Sex hormone replacement. For conditions like hypogonadism, testosterone in males, or estrogen-progesterone in females can be administered to restore normal hormone levels. 2. Medications to suppress. Excess hormone production. For conditions where there is excessive hormone production, medications may be used to suppress the activity of the overactive gland. Anti-thyroid medications. For hyperthyroidism, drugs like methimazole and propylthiouracil are used to reduce the production of thyroid hormones. Somatostatin. Analogs. For acromegaly, medications like octreotide inhibit the release of growth hormone. Dopamine agonists. For prolactinomas, a type of pituitary tumor, drugs like cabergoline or bromocriptine are used to reduce prolactin levels. 3. Surgical interventions. In cases where medication is insufficient or when tumors are present, surgery may be necessary to remove part or all of the affected gland. Thyroidectomy, removal of all or part of the thyroid gland. often used to treat thyroid cancer or large goiters. Adrenalectomy, removal of one or both adrenal glands, typically performed when adrenal tumors are present. Transsphenoidal surgery, a minimally invasive surgery to remove pituitary tumors through the nasal cavity. 4. Radiation therapy. Radiation therapy is sometimes used to treat certain endocrine tumors, especially if they are inoperable or if they recur after surgery. Radioactive iodine therapy, commonly used for treating hyperthyroidism and thyroid cancer. The radioactive iodine selectively destroys thyroid tissue, reducing hormone production or eliminating cancer cells. External beam radiation, used for pituitary tumors or other endocrine cancers that cannot be surgically removed. 5. Lifestyle and dietary adjustments. In addition to medical treatments, lifestyle and dietary changes are often recommended to manage endocrine disorders. Dietary management. For diabetes, a balanced diet that controls carbohydrate intake is crucial. Patients are often advised to monitor their blood glucose levels regularly and follow a diet plan that maintains stable blood sugar levels. Exercise. Regular physical activity is beneficial for managing diabetes and can help reduce the risk of complications in other endocrine disorders. Weight management. Maintaining a healthy weight is crucial for managing endocrine disorders like polycystic ovary syndrome, PCOS, and type 2 diabetes. Weight loss can improve insulin sensitivity, regulate menstrual cycles, and reduce the risk of complications. Stress management. Chronic stress can exacerbate conditions like hyperthyroidism and adrenal disorders. Techniques such as meditation, yoga, and mindfulness can help manage stress and reduce its impact on the endocrine system. 6. Monitoring and follow-up. Ongoing monitoring is essential for managing endocrine disorders. Regular follow-up appointments allow healthcare providers to assess the effectiveness of treatment and make necessary adjustments. Blood tests. Regular blood tests are conducted to monitor hormone levels and ensure they are within the desired range. Imaging studies. Follow-up imaging may be required to monitor the size of any remaining glandular tissue or tumors. Patient education. Educating patients about their condition, treatment plan, and the importance of adherence to medication and lifestyle changes is vital for successful long-term management. 7. Patient support and counseling. Managing an endocrine disorder can be challenging, both physically and emotionally. Providing support and counseling can help patients cope with their condition. Support groups. Encouraging patients to join support groups where they can share experiences and advice with others facing similar challenges. Mental health support. Referring patients to a mental health professional if they are struggling with the psychological impact of their condition, such as anxiety or depression. Conclusion. Understanding the diagnostic procedures and treatment options for endocrine disorders equips you with the knowledge to effectively manage and support patients with these conditions. The endocrine system is complex, but with a clear approach to diagnosis and treatment, many disorders can be effectively managed, improving the quality of life for those affected. This concludes our in-depth class on the endocrine system. Feel free to review the materials, ask questions, and engage.